New at 10, as COVID cases continue to surge, we are taking a look at hospital wait times. And we found out those long waits are happening at emergency rooms across the nation. Local hospitals tell us they're working as fast as they can to provide care, but patients should know there are alternatives. So we're getting a first-hand look at a local hospital's ICU tonight to see what healthcare workers are dealing with. Fox Carolina's Jarvis Robertson joining us live from Pelham Medical Center with more on what those frontline workers are experiencing and what you at home need to know.
Well, Victoria, I spoke with doctors and nursing staff here at Pelham Medical Center earlier today. We are 18 months into this pandemic, and things are certainly getting harder. However, the healthcare workers I spoke with today told me they're still up for the challenge. It's a busy time for hospital workers while battling the COVID pandemic.
For several weeks, almost every single one of those beds has been filled with an admitted patient.
At Pelham Medical Center, Dr. Elizabeth Atkinson says most of the beds in the ER are filled with COVID patients, leading to the team to get more creative in their healthcare approach.
We're seeing patients in hallways. We're seeing them in chairs when they should be in monitored beds. We're trying really hard to see everybody that we can.
And hospitals are also experiencing increased wait times to a certain extent.
That's unfortunate because, for me, I don't like to have patients wait, but we are absolutely strapped to the maximum.
We are seeing sometimes large pockets of people coming in simply seeking COVID testing.
Dr. Serby Gower is the chief medical officer at Bon Secours St. Francis. I was also told in a statement that processes have been put in place to help triage patients more efficiently, but they couldn't go into specifics. I spoke with a nurse at Pelham Medical who works in the ICU. He says that department is pushed over capacity.
Traditionally here at Pelham, we had a 4-bed ICU. We've had to double into an 8-bed ICU.
And at times that's not enough, but staffers will pull together to make sure care is provided through a high-stress environment.
And we have patients on the floor, 4 or 5 at a time, that need to be in the ICU, but we don't have room for them.
Although it's a tough time for providers, physically and mentally, their determination to get through this pandemic outweighs the issue at hand.
If patients would understand to try to be, patient understanding of our limitations and our challenges.
Now, you should assess what you need as far as it relates to your medical care. Sometimes you can head to an urgent care or immediate care facility and get treated faster than coming to the emergency room. In addition to that, if it's just a COVID test that you are needing, you can go to several other facilities to get that done, again, without coming to the ER. We're live here in GREER tonight. I'm Jarvis Robertson. Back to you.